Yeah, good evening, and how are you? I'm live, Abby. Sorry for the delay. Yeah, how have you been now? I was supposed to go live with my device, but the device decided to disgrace me tonight, so I'm using my phone. Yeah, how far now? How are you, and where are you watching me from? Sometimes all these things could just decide to disgrace their father, not you. I can see, say we get some people in the house this evening. Who and who they here? Who they watch me? I'm live on Facebook and I'm live on YouTube. The time is 8:07 p.m. Can you hear me? Patience Sunday, how far? You did hear me at all? Yes or no? Patience Sunday, can you hear me? If you can hear me, just say yes, I can hear you. Good evening, everybody. Good evening, and how are you? If you can hear me, just say yes, I can hear you. You understand? Yes, okay. Yes, you can hear me. Very good. Where are you watching me from? Chidebere, good evening. How are you? Maxwell, good evening. Watching from Anambra. Okay. How is Anambra now? Ngozi Amina, good evening. How are you? How is the sound? Is it clear? Is it very clear or it is shake? Susan, Susan, I see you. Good evening. Maxwell, yes, I can hear you. Hmm. Yes, I can hear you. Very good. Okay. Oh yeah. So this evening, I just say ma come online small ma chat. I dey use phone. I dey use this phone take do my live stream. Yeah, good evening. Okay. Yeah, good evening. Princess, good evening. I see you. Okoro Margaret. Yeah, good evening. Yeah, watching from Germany. Okay. Yes, I can. Good evening. Yes, I can hear you. Watching from Lagos. Okay. From Nigeria. We're in Nigeria in Kiruka. Esther, how you doing? Okay, so this evening, patience, I see you too. If you get any questions, I beg, ask me. The whole stuff where I won't do just disappoint me this night. If I show you the things where they here, laptop they here, light they here, everything just scatter, the thing no gree work. Martina, how can I connect? You are connected already. You want to connect where? Martina, on YouTube. You're watching me on YouTube, right? Abia State. Okay, good evening. Watching from Cameroon. How is Cameroon now? Jim, I see you. Jim Ogbeide. Who's this? Amarachi. Um, oh my God. Somebody wants to call me right now. Oh my God. Seen from Germany. Yeah, from Germany. Ade watching from Abuja. Um, yeah. Oh God, my chat this person up. Okay, from Italy. Okay, from Italy. Good. Oh yeah. Share the live, guys. Ladies and gentlemen, share the live. I'm feeling pain and I'm pregnant. Joy by name. Joy, number one. And everybody here, please read what is on the page, guys. I beg. I don't prescribe drugs online. So don't come online and be asking for drug. I need drug for this. I need this is not a clinic. It's very dangerous. You will collect medicine that might give you problem. This place is just to teach you, to educate you on what you need to know, how to help yourself so that you don't fall into the hands of scammers. You understand? So if you come online and you're asking for medicine, I can't do that. Please, you understand? I can't, my dear. So Stella, you are feeling pain, you are pregnant. Have you registered for antenatal care? Esther, Go and see your doctor. Don't come online and be asking for medicine. Go and see your doctor. Yeah, please. Um, is it good for a diabetic person to be licking honey? Secondly, please, doctor, does diabetes affect fertility in man? Is it good to be licking honey? Why are you licking honey, for God's sake? My question would be, why are you licking honey? The whole problem with diabetes is that your blood sugar is under control. So if your blood sugar is under control, you can live your normal life. You can eat whatever you want to eat. The most important thing with diabetes is that your blood sugar is under control. Now, if you don't control your blood sugar, it can affect fertility, it can affect your performance, it can affect your immune system, it can affect your heart, it can affect your kidneys, it can affect your eyes. I believe we are sharing the live, huh? Good. Please, what meal can we get iron? You want to get iron from your meal. Are you lacking iron? Are you deficient in iron? If you are deficient in iron, we'll just tell you basically go and take iron supplements. But you can get your iron from your milk, your egg, your vegetables, your plantain. Yeah. I have a question to ask. Please go ahead, ask your question. Please, how can you manage pile while pregnant? Have you watched the video I made on oh, this system is fucking up, man. God. What's all this rubbish now? What be this? Have you watched the video on pile? You cannot manage pile on your own, madam. They see, don't allow anybody deceive you. Nobody can manage pile on social media. Nobody can manage pile for you on social media. Don't be deceived. Well, you might want to believe me, you might not want to believe me, but when you suffer from the hands of people who don't care about your health, then you would wish you listened. Nobody can manage you for pile on social media. Why? What type of pile do you have? What is the degree of your hemorrhoid? Is it first, second, third, or fourth? If it's first degree hemorrhoid, most times your hemorrhoid can, it will, on its own, it will disappear. They might tell you to do 6 baths. They might tell you to watch what you eat so that your poo is not hard. Basically, you understand? Yeah. So I beg, I don't know the type of hemorrhoid you have. I can't even manage you online. If you watch the video I made on hemorrhoid, you would understand that I told you to go speak with your doctor. Doctor, does the infection cause scratching on the skin? Yes, depending on the type of infection. Not only infection can cause itching of the skin. Infection can cause itching of the skin. Allergies can cause itching of the skin. Hormonal problem can cause itching of the skin. Problem with the liver can cause itching of the skin. Problem with the kidney can cause itching of the skin. Creams, yeah, all these stuff can cause itching. Weather. Adebayo, good evening. Jim, yeah, okay, cool. Are they chatting from Ojodu? What food can I take to boost my immune system? There's a video, oh God, there's a video on how to boost your immune system on my page. Rest, take fruits, take water, eat balanced diet, your immune system would go up. Rest, very important. Good evening, Tracy. Good evening. Oh my God, you don't come with this your name. I see you. Please, where can I watch the video concerning pile? It's on my page. It's on this page you are watching me. On this page is there. Just leave the live stream. Scroll my page. My dear? Scroll. You go see the video there. It's like people don't even understand that I make videos to teach. I make videos to teach. So the video day Facebook, the video day YouTube. I don't know where you're watching me from. If you're watching on YouTube, go through YouTube. You will see the video there. If you're on Facebook, just scroll down. Just scroll. Go on my page. Click on videos. Just scroll. You go see I'm hemorrhoid. Is there, please? I added a lot. It's about 10 minutes or 14 minutes. I beg. Watch them. Is it normal not to see the ovulation for some months? It's not normal not to see ovulation for some months. It's not normal not to see ovulation for some months. So my question would be, how do you know that you are not ovulating? How do you know, Amarachi, how do you know that you are not ovulating? Because sometimes you might be ovulating and you will not know. Yes. Again, I made a video on the signs of ovulation. Try to watch the video. It will help you a lot. There are different signs of ovulation that you need to know about. Pain, discharge, temperature, mood changes, so many of them. So how do you know that you're not ovulating? Juliet, good evening. How are you? Thank you. Thank you. Please watch it. Yeah. What is the cause of losing appetite? What is the cause of losing of loss of appetite? So many things, many. I'm just going to list few. I hope I remember few. You can lose your appetite. Number one, if you get a sad news. If you have depression, you can lose appetite. Let's say you lose your money, you lose a job, you lose a loved one, you can lose your appetite. Certain infections can make people lose appetite. Um, what again can make you lose appetite? Nutritional deficiencies can also make you lose appetite. You understand? Yeah. When you lack certain nutrients, when you have certain infections, when you have depression, change in life events that affect you, you can lose appetite. Malignancies, cancers can make people lose appetite. So there are a whole lot of stuff. Yeah. Ade from Ojodu, please, can ulcer be cured? The patient is 73 age, and can she get rid of ulcer in her stomach? How do you know she has ulcer, Ade? Number one, listen carefully. Uh, have you watched my video on ulcer, Ade? Yes or no? No, I believe no. So watch the video on ulcer. How do you know she has ulcer? This is important to me. This age is important. So you have to be sure of that diagnosis. If it is ulcer, they can manage it. If it's not ulcer, you have to find out what exactly is causing the ulcer or what is causing that problem. So, my bro, don't come online and tell me it's ulcer if it wasn't diagnosed with the right method of diagnosis. There is a right method to diagnose ulcer. Hmm? There is a right method to diagnose ulcer. And if you don't get that diagnosis right, you might be treating rubbish. So how do you know it's ulcer? Number two, ulcer can be managed, very importantly. Number three, if it's not ulcer, you have to find out what it is. Good evening. Is it normal for period to flow in the morning and not flow in the night? No, it's not normal. Your period should flow for 3 days, 4 days, or 5 days and then stop. Is it good to use seretide and Ventolin in at a time? I don't understand this question. I don't understand the question. Please send it again. Make it more clear. Ngozi, did you send? My God. Ngozi, did you send stars? I don't know if you sent stars. I can't check. I'm using the phone to stream. Yeah. Thank you. Alex. Alex, how far now? How you there? What causes pain or stabbing? What causes pain or stabbing that lasts for seconds in the right and left abdomen? No idea. My guy, no idea. I can't tell you what is causing your pain. I don't know anything about the pain. Yeah. I don't know what is causing the pain. So I can't come online and tell you this is what is causing your pain because there are so many factors you need to know before arriving at a diagnosis of pain. Stabbing pain. It could be from the intestine, it could be from the kidney, it could be from the muscle. There's a whole lot to know about pain. I can't tell you what is causing the stabbing pain, and it lasts for seconds. So if it lasts for seconds, maybe job, work, certain things the person might do that might cause the pain. Ngozi, you sent me stars. God bless you. The rest people are not sending us stars. You understand? They ain't sending us stars. Ade from Ojodu, she has done tests. Is peptic ulcer the doctor called it? I have watched a video on ulcer and I told her, oh, you sent the video. Okay, so now we are discussing. How did they diagnose the ulcer? Tell me, Ade. How? Is it scan or blood tests? How did they confirm that what she had was peptic ulcer disease? Number two, what have they done for her? I'm not managing you, but I'm trying to arrive at a point to know how to advise you. Remember, this place is not a clinic. Eh? Is it good to use seretide and Ventolin inhaler at a time? Seretide and Ventolin inhaler at a time. When you say at a time, oh God, at a time. So seretide together or separately? I don't get it. Seretide and Ventolin at a time. One at a time or together. Which one? It's not clear, Florence. That is number one. Number two, this stuff you are using, who prescribed it for you? What causes sore throat? I do feel something like pimples inside my throat. Get it examined. Get it examined. Get it examined. That's just the best I can tell you. Get that stuff examined. It has to be examined, but I don't know what is causing it. If you feel something in your throat, somebody needs to look into your throat to know what it is. Yeah, my mouth is dry, so I don't know. Sometimes when I'm stressed, my mouth dry. I'm not gonna vex. So generally, I don't know what is causing the sore throat for you. If you are feeling something like pimples in your throat, a doctor needs to look into your throat to find out what it is. You understand? Yeah. Rejoice, how you dey? After the period, I expected to see it, but not coming. Only last month, it just dropped a little, only one day. Meanwhile, it lasts 3 to 4 days. Okay, so Amarachi, is this the first time it has happened to you in your life? Is this the first time it has happened to you? Yes or no? Tell me. Is this the first time? Yes or no? If this is the first, so this is my reason for asking. If it's the first time, give your body time, relax. Maybe something happened that caused it to change. But it has been happening every time, every time, every time. I would advise you to see your doctor. Why I'm saying this is because if it's occurring almost every time, it means there's a problem. Something is changing your period, which is not okay. But if this is the very first time, don't panic, don't cry or give yourself sleepless nights. I would advise you to relax. Check it again the next period. It might regulate. Can H. pylori affect children? Yes, it can affect kids. Yes, sure. They collected her blood and poo-poo. That's not how they make diagnosis of peptic ulcer disease, bro. That is not how they make diagnosis of peptic ulcer disease. That is not how they make diagnosis of peptic ulcer disease. I'm being blunt with you. It's just suggestion. Listen, doctors will tell you we take your blood, take your poo-poo, we do urea breath tests to find out if you have anything suggestive of H. pylori peptic ulcer disease together with the symptoms. But to be sure that this person has peptic ulcer disease, as I explained in that video, you would have to put something inside the nose or the mouth to the stomach and look at it. That is how you confirm. So I don't know. I'm just trying to tell you how it is. What causes period to disappear? Okay, the video is on my page. Please go through my page. You will see the video there. I made a video on this. So many things cause period to disappear. So many things. Pregnancy, number one. And I know you will tell me that you're not pregnant. Number two, stress can make it disappear. Number three, hormonal changes. Number four, number five, number six, number seven. I listed a whole lot of them in my video about, I think, 9 or 10 courses. So I would advise you, okay, what's the name? Fulfillment. Try watch the video. The reason I'm directing you guys to those videos is because I took my time to make those videos. So you'll be doing me a whole lot of good by watching the video. If not, it's like what I'm doing is a waste. Sure, you get. That is why I'm telling you, please watch the video. You would see pictures, a lot of stuff inside the video that would help you understand. Please watch it. It's on Facebook, it's on YouTube. Yeah, thank you. Yes, this is the first time. Okay, so I've given you the answer. Yeah. My doc asked me to get seretide. I'm telling you here. Seretide morning and night. Why I'm telling you whenever I'm having an attack. Oh, now it's clear. You see, you people should stop giving us half information now, for God's sake. Oh, don't see, please, I beg you. There's a reason why we ask questions. Your doctor is in the best position to manage you, not me. And that's number one. Number two, there are things your doctor, oh, is not clear. You can explain, then I would help you break it down. Yes, Ventolin is take it when you have an attack. If you don't have an attack, keep it. Seretide, and I also believe that they would tell you how long you should use your Seretide, Abby. They're not going to tell you to use it forever. So they will tell you use it for so number of time, and then you might give your body a break and watch how it goes. While your Ventolin should be used when you have an attack. Yes, sure, you can use it. Um, you can. Your doctor knows why he gave that to you, so no need to panic, Florence. Yeah. Blessing, good evening. Are they? Yeah, yeah, thank you. Doctor, what causes high level of neutrophils and ferritin in the blood? Oh my God. Okay. Oh God. Tell me you didn't go and carry out a full blood count on your own. Martina, tell me you didn't go to carry out a full blood count on your own. And just tell me, I need to be sure that you are not managing yourself. So the common cause of high neutrophil count is infection. When somebody has a bacterial infection, your neutrophils would go up. We have different types of white blood cells. We have neutrophils, we have basophils, we have eosinophils, we have monocytes, we have lymphocytes. These are all components of your white blood cell. Now, when any one of these white blood cells go up, it gives us an idea of what is happening. So, where are you getting this? Where is this question coming from? I don't just answer question because, oh, answer me now. Where is it coming from? So that I can help you, not because I want to chase you away, not at all. So that I can tell you, at least to the best of my knowledge, oh, the right thing. That is what I'm asking. So where is this question coming from? Please, is it good to go to toilet daily to poop every morning? Yeah, sure, it's okay. I do that almost every day because I take water every morning, so it helps me. As long as you are cool with it, no problem. Your body, fine, sure, it's cool. For some people, it's once in 2 days. For some, once in 3 days, whichever is good for you. Florence, hi. Okay, good. Yeah, Jennifer, hi. How are you? Okay. Wow, this stuff just disgracing Papa. Not me though. Not me. Let's see. Okay. Uh, what again? Any more questions? So, Martina, where is this question coming from? Let me know, please, how to advise you. Okay, no more questions. 16 people watching. Now, the funny thing about these live sessions is that I have these live sessions so that I can answer some comments. I don't really do this chats. People will be chatting you. Oh yeah, now I want to chat you. Answer me now. I don't do chats on social media. I don't do it, and because I don't have time, and it doesn't give you the room to explain to people. Thank you, Alex, for the stars. Thank you. I can't see it, you understand, because of this platform here. But God bless you. Thank you so much. Mr. Alex sent me 100 stars. Ladies and gentlemen, tell him thank you. These are the people encouraging us more to be on the live stream. God bless you. What can cause light period? So many things. It might be age. It might be age. When a woman is getting close to menopause, it might be age. I'm not making any diagnosis for you. It might be age. It might be hormonal changes. You understand? Yeah. It might be stress. So there are many factors involved. Many things involved. Yeah. Bosse, I see you. How can I reduce sugar from my system? Do you have high blood sugar? Mercy. Come on, guys. I have to say something very clear. I don't know if people watching me have been coming to my live stream. How do you reduce sugar? This question is very shallow. How do I reduce sugar from my system? I am diabetic. Oh, clear. How do I reduce sugar from my system? I just want to know because they told me my sugar is high. How do I reduce sugar from my system? I just feel like I want to reduce sugar in my body. These are three very different questions, oh madam. So why do you want to reduce sugar in your body, please? Hmm? Let's go, please, guys. Talk to me quickly. Why do you want to reduce sugar in your body? Is there a problem with your blood sugar? Yes or no? And how did you get to that diagnosis that you have a problem with your sugar? Mercy, Obebo. Oh yeah, oh yeah, talk to me. No time, no time, no time. I'm talking to you. Respond now. Mr. Alex, thank you so much for the stars. Ngozi Amina, thank you for the stars. Thank you for the star. God bless you. God bless you. God bless you. Let's see. What again do I have? Okay. Yeah, Alex, thank you. When a lady monthly period is 29 days, please, when is the ovulation period? Oh, you won't understand if I tell you. Her ovulation period is on the 15th day of her cycle, 15th day. But you won't know how I got 15th day. You won't understand how I got the 15th day. So watch the video on YouTube. There is a way to calculate it. How to know the day of your ovulation if you have a 29-day cycle, if you have 30 days, if you have 28 days, if you have 21. Whatever it is, the number of your cycle, remove 14 days from it. But you have to know how we got there. So if your cycle is 29 days, your ovulation is on the 15th day, around that. So from the 13th, 14th, 15th, even 16th day of your cycle, that period, you're most likely to get pregnant. Doctor, doc, I hardly poo-poo. I can stay 3, 4 days without poo-pooing. I would advise you. Did you watch the video on constipation, Jennifer? Yes or no? I would advise you try to change some things in your body. If you have been following me very well, you would know about early morning water. You will know about fruits, about vegetables. These are stuff you can try to help improve your bowel movement. Try it and see. Yeah. The person that asked me how can I reduce sugar from my system, you have not responded to me. Make una dey make this thing sharp sharp. I'm talking to you so that it won't look as if I'm ignoring you. Now I answered. I do check my blood sugar and it's not high, but I urinate more often and I can hold my urine. So listen carefully, madam, please, and listen carefully. Please and please listen carefully. In the name of God or whatever that you worship, please, I beg you, unless a medical doctor tells you that your blood sugar is above normal, is high, oh, we need to bring it down, please do not look for anything to bring down your blood sugar. Yes, it's good to monitor your blood sugar, check your blood sugar from time to time. I tell people maybe very soon I might begin to have online patients that can register so that every month, anytime you want to speak with me, I'll make myself available for you. So me and you can interact. Maybe every month you pay a certain amount of money so that I can do that. But please, I beg, as long as your blood sugar is not high, you have no problem with your blood sugar, please live your normal life, please. Now, if you urinate more often, it's important we find out why. Why are you urinating often, madam? Is it from your bladder? Is it an infection? Is it hormonal related? Is it from high blood sugar? Is it a mass on the bladder? So there are many factors. Do not, please come online and be asking questions. I want to reduce my blood sugar. How do I do it? And then somebody will now tell you to go and buy something. And when you drink that stuff, you put yourself in trouble. I beg. How do I send stars? Oh, you want to send me stars? If you want to send me stars, for those that don't know how to send, go to Facebook, join this live on my Facebook page. Go to Facebook, join the live on Facebook. You will see $sign. You see $1 beside your comments. That $sign, you can click and send any amount you want to send. That's better. For Facebook, it might be hard for you. God bless you. I did this urea test and it's positive. Is this mean H. pylori positive? What can I do? No, it doesn't mean. It doesn't mean. So let me help you. Deborah. Okay, very good question. Please listen carefully. If I test myself for H. pylori I might be positive, but that does not mean I have ulcer. What it simply means is that there are so many people who are positive with H. pylori, but yet they don't have peptic ulcer disease. Not because we see H. pylori in you, then you now have peptic ulcer disease. However, we know that from a lot of people who have peptic ulcer disease, H. pylori is the commonest cause of their ulcer. Ulcer could also be caused by medications. Are you aware? So I beg you, because you did your urea breath test, here is positive, H. pylori positive. I would advise, if you have the funds, if you can, do an upper GI endoscopy. Upper GI endoscopy simply means that they will take, again, a camera into your throat, the man look into your stomach and find, oh, yeah, you have ulcer or you don't have ulcer. Yeah. No, I didn't. I did it in a lab. You did it in a lab. Why? Why? Tell me, Martina, why? Talk to me. Don't worry, I'm with you here. Is mastitis common during pregnancy? No, it can happen anytime. It can happen anytime. That would be nice for the online monthly subscription and consultation. Yes, Mr. Alex, these things are not easy, you know. I'm trying to build my website. If I build my when I have the money to finish building my website, then I will direct everybody to the website, and then you pay from the website online consultation monthly fee. Then I know that I have this number of people that have paid for this month. Anytime they have a complaint, they call me, we discuss. So it takes time. I'm working on it. I hope I get funds to settle this and to help those online, those that are outside Nigeria. From Certified Lab, yeah. So my question, Martina, is why did you carry out the test? No problem. I agree. You did it at the lab. Good. Why did you carry out this test? You see, this is the reason why I tell people that before you carry out any test, it's important you speak with your doctor. There are reasons why people carry out tests. Why? Now, I'm not treating you. I'm not your doctor. I'm just on social media, just teaching and I disappear. So, to help you, why did you do the test? Hmm? Why? Tell me, please, so that I know why. What was the reason for the test? What was the reason for the test? Was there a problem, or you just woke up and you went to the lab? And then, who is treating you? Who is managing you, madam? Please tell me. Please talk to me. Oh yeah, let's go. No time, no, ladies and gentlemen. Please talk to me. No time. Oh God, everywhere is hot. Everywhere is very, very hot. This live session has been going on for 32 minutes. Oh yeah, let's go. No comments. Those that want to send stars, just go to YouTube. Go to my YouTube live. Join this live on YouTube, and then you will see beside the comment section where you can. That is if you want to send. Yeah. What again? What do I want to say again? No. I want to talk something. I forget. Please, the reason why I come online like this is to answer a few questions and then I disappear. Yeah. Please, guys. I don't do private chats. I don't do private chats. A lot of people want to send you inbox message. I beg, no vex. Oh yeah, Martina is not responding. Oh God. I don't try. No more comments. No more comments. Okay. No more comments. No more comments. Wow. Okay. Talk to me, oh hell, God. Okay, I guess my time on the live stream is up tonight. Ngozi, I did now. Ngozi, I did now. You did not follow my page. If you check my page, you will see I did now. I did on Facebook and YouTube. I dropped it. Check. You will see that I did. Even on my group, on my Facebook private group. I dropped it. You look stressed out. You look stressed out. Do I? Really? Ha. I don't know. I'm just I can be on this live stream for the next 1 hour. If I get people here that ask questions, I could be here for the next 1 hour answering their questions. It's what you need to do for people. I'm not tired though. Hmm? Do you know why we do tests without doctor? Do you know why we do tests without doctor? Do I know why? Or are you asking me? Or one might be ignorance. One reason might be ignorance. Number two, second reason might be you're looking for a solution. You understand? The first one might be ignorance. Second one might be you're looking for a solution. Is there another reason? Third, I don't know if there's another reason. No vex. But that's what I think. Have you been working tirelessly, Alex? You uncle, have you not been working tirelessly? You uncle, see who they talk. Oh, you where they sleep for staring. Thanks a lot for the education. We appreciate much love. Thank you so much. Ngozi, Alex, Margaret, Susan, so many of you. Thank you so much. Huh? You guys are too much. My brother, I've not been working tirelessly. Oh. I've not even started working. Believe you me. Hmm? By the time I set up what I want to set up and I begin to have this online monthly subscription, hmm, when I begin to have the monthly subscription, it might be very, very difficult. It might be hard then because you want to help everybody. I know you now, no they lie. You were sleeping on steering one day. uh You did night shift and then something like that. So no, they ask me, now you supposed to the rest. And what again? So these are the things we do, and I don't feel it. Really. Any question again? No more questions. Please, I beg you. If you are watching this live stream, please remember, it's not because I don't want to do private chats. Mm-mm. There are many reasons I don't do private chat again on social media. It brings see finish. There's a high tendency for mismanagement. There's a high tendency that what again? Personal and professional reasons, yes. Brings mismanagement, high tendency for mismanagement, undervalue what you do, and some other stuff that you don't want. You understand? That is the reason why I stopped it. So, in case you are here and you want to private chat me, no vex. I know they do private chat here. Doctor, can I pay for some friends on your monthly subscription? Do you even know the amount? My dear, you don't even know the amount. There's no amount yet now. But monthly subscription, you want to pay for some friends. Hey, God. Ngozi and Alex, two of you. Okay, I'm talking to the two of you. The rest people, I don't really know them that much. I don't know them. That is why. I wish I know some people here. But I know Ngozi, Alex, you have been coming here. Um, Tell me sincerely, how much would be okay for a monthly subscription? Tell me the truth. Let me have an idea. For those of us who are listening to me, tell me how much do you think is okay for a monthly subscription? Because when you now make it a monthly subscription, people want to call you every time. I want to talk to you, I want to call you, video call, phone call. So how much is okay for a monthly subscription? And if it's okay, as soon as I get my website ready, I'll tell them to put it in the website, then people can register. Doc, please, I had an overactive bladder after a series of antibiotics. Is there a possibility it would stop along the line? A series of I had it. Is it? Yeah, it will. If you are sure that it was due to the antibiotics, it will. That's number one. Number two, uh, number two, you have to be sure that it is from that antibiotics or it's not something else. If it's from the antibiotics, over time, and there are other factors to consider: your age, the bladder, how overactive is this bladder? Very important. But if it's due to the antibiotics, it should. Me personally, I do my PCV myself and malaria test because our hospital take our time too much. I went to hospital yesterday to check my pelvic area. It took me a whole day, and I have a lot of clothes to sew for customers in shop. Yes, Ade, I understand. Let's see, let me not lie to you. I really do understand. This is one reason we are trying to bridge the gap. Maybe rather than spending hours in the hospital, you can speak with your doctor online. Oh, this is what I want to do. I want to do it. Do I? The doctor will tell you, go ahead. There are so many reasons. Now, PCV is not enough, my bro. PCV is just one component of your full blood counts. Your PCV might be okay, but your platelet is very high. Now, you don't even know what platelet is. You don't know what platelet does in the body. Or your PCV might be normal, or your lymphocyte count is extremely high. So these are stuffs that would help us. Or you have a within normal PCV and your MCV is low. This is why we always appeal to people that please, before you go for any test, try to speak with your doctor and try. I know that hospitals are choked up. We have few doctors, few nurses. Hospitals are very few right now, and people spend a lot of time there. Even me, when I went to the hospital for something else, it took me a while. In fact, we even spoke with the doctor there. No vex. Please, can you put more light on mastitis? Mastitis is simply inflammation of the breast. I don't know. There are many things that can cause inflammation, infection, trauma, allergies, mastitis. That's basically what mastitis is. But if there is something about mastitis you want to know, please ask me, yeah? Somebody says you can model Wi-Fi from MTN. Tell me more about it, Jimmy. I don't understand. Start with affordable prices according to your website expenses, but I bet you a lot of us will subscribe and pay for people who cannot afford it. Oh, okay. This is encouraging. This is encouraging. It's like different prices from what kind of job 150K upward. For what, please? For what is this, Jimmy? Jim, I don't understand though. I don't understand what you mean by this. 120, no, please, oh, no, is it 120 for a year or 120K for a month? Let me understand, I beg. Which one is platelets? You see why I tell you that you have to speak with your doctor. My bro, I'm not trying to make you scared though. Neither am I mentioning something very big. I'm just letting you know that PCV is not enough. Please. If for any reason you want to check your blood, your doctor knows what to tell you. Not because he wants your money or he wants to prove that he's a doctor, but just to help you, my dear. Doctor, what is MCV? It mean corpuscular volume. MCV means mean corpuscular volume. You see, and you don't know what it does. So this is no vex that I'm using these big words. They're not big words, actually. They are basic stuff that your doctor needs to see. So that's why I beg you. You want to do any test, I beg, speak with your doctor. You get why? So that you don't waste money. Mary, how are you? Yes. Ngozi, yes, what? 120K per month. No, now, no, nobody can afford that. Even me, I can't afford it. I can't tell anybody online to subscribe 120K per month. It's too much. Trust me. It's too much. So let's have an agreement. The reason I'm saying this is because I know that some of us are outside Nigeria. Some of us, people have asked me that can you be my doctor? I can be calling you. I don't know. I want to try to do it. I want to try. I need to have a range of amount. There's an amount I have in mind, but I want to know if it's affordable for people. We know, as you say, they call something out of the moon. You understand? Yeah, Mary, how are you? The topic, no, it's a Q&A. Look at it. We're having a Q&A session. At the same time, I'm saying this, that I want to start a monthly subscription whereby when you subscribe and you pay for that month, you have access to call to speak with me. You have any stuff for consultation. It could be a phone call or it could be a video call via the website. So we are trying to talk about how much we put as the lowest price. It's a fixed price for everybody. Nobody's going to be on high plan, low plan. I beg, I can't do that. How will I know if breast is inflamed? Oh, really? Okay. How will you know if breast is inflamed? Number one, might be red. These are the signs of inflammation. Basically, they are signs of inflammation. So let me just list the signs of inflammation for you. Red, area could become red. The area could be painful. The area could be hot or warm. The area could be swollen. So these are the signs of inflammation taught in medical school in 400 level pathology class. They will tell you these are the signs of inflammation. There are 5 signs, actually 5 signs: pain, redness, the area becomes red, the area is swollen, and the area is hot. And then the fifth one is that uh, loss of function. You can't use that area really. Yeah. Okay, that should be nice. I just send your link to MTN already to chat you on Facebook or Wi-Fi price, but it's different though. You send my link to MTN to chat with me? Really? I don't understand. Tell me more. Jim, you sent my link so that hey, MTN to chat with me. You work with MTN? This is not clear. To chat you on Facebook or Wi-Fi price, but it's different. Okay. Yes, I mean the payment should be paid for a month and 10 to 20K per month should be okay. 10 to 20K per month. Alex, what do you think? Monthly, 3 months, 6 months, yearly, or lifetime subscription? Ah, my brother. Doctor, see, Shebi, you are following me on my special group, my private group, Abby. I'm going to put this up in my private group. I think those in my private group are those that really, really follow me. I'm going to put this up. I'm going to tell you guys to select which amount to put for the subscription. 10K, 20K. How much again? I'll tell you to select, you understand? So that it won't look as if I'm just breathing out from my head. Yeah. Doctor, if someone's father has prostate cancer, can his daughter or son have risk of cancer? Very good question, Ade. Oh, my time is almost up on the live stream. Very, very good question. Now, if your father has prostate cancer, there is a risk. There is a risk that the son can have prostate cancer. Everywhere is hot, so I'm getting up. There's a risk that the son can get. There's a risk, not that he's going to have it, but it puts him at risk. There are so many people who have prostate cancers whose fathers never had prostate cancer. Now, for the female, if her mother or her aunt or her sister has breast cancer, has ovarian cancer, has breast cancer, ovarian cancer, endometrial cancer. Which other cancer again? I can't really remember. It puts her also, and even colorectal cancer, yes, for both sexes, male and female, it puts her at risk of having cancer. Yeah. Yeah, thank you so much. I appreciate it. I don't know if I gave you what you were looking for. What causes boil in the private part and refuse to heal? That is not boil, my dear. That is not boil. That cannot be boil. Boil most times comes, it swells, and after a while it ruptures, pus comes out of it, it resolves. So if you're having swelling around your genitals, it might not be boil, it might be something else. Yeah. Why am I almost coming late? Mary, no, now you came early. No, I don't work in MTN. I work and live in Germany. Okay, but I have something running from some guys. Okay, but the way you sent your message, it wasn't clear to me. Yeah. That was what I was asking, Jim. It wasn't clear. I wanted to know. Are you saying that because the amount you posted there was quite very high? I can't put 220,000 naira for subscription. They will shut my account down. It's like I just come online to rip people off. Yeah. But it has to be a price that people can afford. Most especially those who are outside. I'm also thinking of doing something. I'm thinking of discussing with some of my teachers who are specialists, so that on the platform, if somebody want to speak with a cardiologist, or you want to speak with a gynecologist or a nephrologist or even a psychiatrist, you can have access over there, and you pay and then maybe I take small percentage from that. But just trying to look for a way to just help. It's not easy though. There's so much misinformation, and people are really looking for solutions outside. You understand? Is there any age that a lady can have cancer can show up? Is there any age? Any age? Cancer can appear at any age. Trust me. There are cancers that occur in children. There are cancers that occur in middle age, in elderly people. Cancers can occur in any age. That this is why we tell people don't joke with symptoms. Please always speak with your doctor. I beg people, please. It's hard, especially for those of us living in developing nations, to have doctor you can call. It's very difficult. I would appeal to you, please try to get a doctor you can speak with any time of the day. Very important. I'm always having boil in my eye, always having boil in your eye. Boil, boil, boil. It's not boil, my dear. That's not boil. On your eyelid, Abby. On your eyelid. That might be stye, stye. That might not be boil though. If to pay for 3 months, it should be low. And if 6 months or 1 year, then it should be lower too. Oh my God, I beg, I never get that power, please. I don't know if I'm in that private group of yours. I don't know. That same Wi-Fi you can use in your house for TV and other things. To okay, yes, yes, I know about it, but I don't use it yet. I don't use MTN Wi-Fi. I use my phone, my device. I share the network from my phone for the Wi-Fi. I know about it. Thank you. Yeah, people subscribe for a year, but this one, I don't know, my guy. We'll look into that. Yeah, yeah, I'll look into that. You need to open a PayPal account attached to the new monthly subscription. I have a PayPal account though. I do have a PayPal account. Yeah, it's functional. I have it. Yeah, I have a PayPal account. So that whoever wants to pay should pay through PayPal, Abi. Ha, voila. God, I beg go. When my breast when I press, yeah, when I press my two breasts, fluid will come out from it, but not much, and I'm not feeling any pain, no strange lump. Okay. Adeni Adenika or Lamikosi. My first advice would be please don't press your breast again. Please don't press the breast again. That is number one. Number two is give it time. Don't press, because the more you press, the more it will come out. Now, I want to say this. If you notice that you are having problems with your period, you are having problems basically with period, with your ovulation, with trying to get um, pregnant and the rest, then speak with your doctor. But if you know you don't have any problems with your period, um, you don't have any issues with your ovulation, please don't press the breast. Give it time. Watch it. It might subside. Trust me. I'm using the word might. But if this has been happening to you for a very long time, please and please speak with your doctor. Yeah. The test and order were requested due to anemia from my doctor. Very correct. Thank you. Now I get it. So your doctor is suspecting that you have anemia, so he requested for you to do a full blood count. So when you did the full blood count, I believe your PCV was normal, but they discovered that you had elevated neutrophil and high and ferritin levels, right? So relax your mind. Don't worry. Neutrophil is like you have an infection. Even ferritin can point towards that too. So I believe they gave you medications to help you. And then if you have anemia, they would also give you medications to help you boost your red blood cell. Please send out your PayPal account to Doctor. Thanks. I should send it out now here or for subscription. Which one? Doctor, how do one heal a bullet injury on the breast? It was stray bullet from the ceiling. Please, I beg, I beg, I beg. Let that person go to the hospital immediately. Yeah? Yeah? Uh, yeah, please. Let the person go. Oh, my PayPal link. Oh, my PayPal link. You want it now? Okay, let me see. But I can't paste it. Oh, let me check. Let me check if I still know that. Let me check this other phone here. Let me check my PayPal here. Somebody says, Doctor, we can send you data credit from Germany if you need it to support your live programs. Come on now. Ngozi, stop. See, guys, thank you so much. I make it a point of duty eh, that I don't run out of data. Do you understand? Okay. I have seen my PayPal link. I have seen my PayPal link here. Let me see what I can do about it. Somebody said I should drop it. I don't know. Hmm, I don't know if I can do that. Okay. Send your PayPal account and pin it here. So, or someone pin it. PayPal.me/doctor. Okay. Let me see if I can do that. Now I'm coming now. I beg, make no vex. I don't know why now they ask for the PayPal, but it's well. Thank you. Let's see. Let me see if I still get it. Let me be sure it's the same thing. Let me see. It is okay. It is. Yeah. What can someone use for knee dislocation? What can someone use for knee? If your knee is dislocated. Okay, let me do this. Let me get my paper quickly. If your knee is dislocated, if your knee is dislocated, you will have to see a doctor, number one. Number two, they will do an x-ray to know the level of dislocation. So here is the PayPal account. Here is it. Here is it. Yeah. Okay. Here is it. Yeah. Thank you. That's the PayPal account there. When you put it, you will see my profile picture, but you will see one name. What's the name? Oh God, you don't say none of X. Okay, that's it. I can't even. Can I pin this? Okay, I can't even pin it. Somebody should pin it. Oh God, I don't even have a moderator here. Okay. Good evening, doctor. Please, I'm sorry because I want to ask questions that is not topic. No problem, Dominic. No problem. My wife did cesarean section during childbirth. Now her tummy refused to go back normal. What medicine for her tummy to come back? Okay, Dominic. Um, I always tell people it's not about medicine. Is your wife? I don't know, when did your wife put to bed? This abdominal fat and that women have after putting to bed, it can really take time for it to go down. So she would have to walk. It's going to be very difficult. She would have to exercise severely, and then there's no medicine. First of all, there's no medicine. There's no medicine. There's no medicine that would say take the thing down. Don't let anybody deceive you. There is no medicine. But those medicines will give you problem. Will give your wife problem in the future. Oh my God, I don't tire. I won't sit down. Those medicines will give your wife problems in the future. So I'll I'll tell you that she should exercise, and then 5 months. 5 months. Okay, she should exercise. Take it easy, please. She should take it easy. It will go down, but she has to exercise, watch what she eats, register at the gym, get someone to guide her, so that she doesn't do the wrong kind of programs that will give her problem. Yeah. Kamara, how are you? I'm doing very well. Can she use tummy what? Tummy wrap? What's tummy wrap? I don't understand. And she has been to the hospital and the drug did not work. Drug does not fix dislocation, Mercy. Dislocation is corrected. See, the word is what? Corrected. They align the bones. So if your bones is displaced, shifts from one side to another, medicine will not fix it. They would have to realign the bones back together, push the bone back, and secure it, whether by POP, by bandage, in whatever form. But medicine will not correct dislocation. Is that okay? Uh, oh my God. Before now, I was thinking it's before food we have to run blood sugar test. But yesterday, I heard doctor telling a lady to run this after food. What is it called? So my guy, Please, I beg you, do not assume that this is it. The doctor told that patient for a certain reason. The doctor told the patient for a certain reason. There are some people we will tell them after you eat, let us check your blood sugar, what we call postprandial, 2 hours postprandial blood sugar test. We have what we call fasting blood sugar, random blood sugar, 2 hours postprandial. So there are many reasons why. You are correct, I beg. It's because you didn't listen to the doctor very well, or you didn't ask him. There's a reason why he told that patient to eat and then go and check the blood sugar. Yeah. These things are the reasons why people will hear from one side and conclude. Hmm? Yeah. Um, I don't go. I have to go now. Doc, please answer me. Bullet wound on breast. How can the wound and pain heal fast? By treating it at the hospital. You can't treat wound on social media now. What be your name? Nancy. You can't. There's no juju. See, there's no juju that would make somebody treat you with injury on injury on social media. The only way to heal and treat your wound is get that wound seen by a doctor or someone, a medical professional who knows how to manage wound. And then they will check the breast, see the extent of the wound, look at the size of the wound, see if the wound is healing or the wound is going to have problems in the future. Check the total state of the patient and then start managing the wound. There is no way I can tell you to go and buy medicine to treat wound on internet. Never. See, they go summon me. You understand? Yeah. Okay, guys. My time is up on this live stream. I have to go. For those in my private group, we can continue this chat there. What again? I think I've tried 1 hour on the live session. Thank you, Alex, for sending stars. People that asked for my PayPal account. Where's my PayPal account again? Yeah, this is it. This is my PayPal. Here is it. I hope that is it. Yeah, is that it? That should be it. Yeah. Good, that should be it. Yeah. Yeah. Other than that, I don't know, but that should be it. But if it's not it, when I come back, I'll check again. Thank you, everybody, for your time. Make it no vex, I beg. But I really do have to go now. God bless every one of you. Please, I beg. Don't joke with your health. Please and please and please and please. This is the reason why. Okay, this question is here. If my wife is pregnant, she always have high sugar levels. What causes it and how can we prevent it? You prevent it by ensuring that she's monitored before she gets pregnant to be sure that she doesn't have high sugar. During pregnancy, some women's high blood pressure can go up. It could be from hormone. It could be from hormone that occurs in pregnancy, or it could be from placenta stuff. But basically, hormones that occur in pregnancy. There's what we call gestational diabetes. Gestational diabetes called GDM. So this diabetes occurs in pregnancy. Yeah, I don't really know how you will prevent it. The only person that can actually help you is a gynecologist, not me. You understand? Yeah. So I encourage you to speak with a gynecologist. Next 2 weeks, ladies and gentlemen. Oh, my PayPal account is right. Oh, it is right. You confirmed just now. Jim, okay. Next 2 weeks, I'm going to have a discussion with some people on my live stream, and there will be giveaway. It's a supplement company. We're going to have a discussion, and there would be giveaway. I'm hoping that it finalizes. So I'm just letting you know so that you don't miss it out, especially for those of us that have been coming here every time, so that you don't miss it out. You understand? Let me let you know. In the next 2 weeks, we'll be having a live session. We'll be discussing. There will be giveaway for 3 people, hopefully, and it will be very, very, very engaging. So don't miss it. Thank you all. God bless you. Remember, Good life. Good life. Nonsense. Ngozi. Yeah, yeah. So let's continue this chat on my private group, Dr. Fredostar special group. Dr. Fredostar special group. You can search for it on Facebook, Dr. Fredostar special group. Join, we would accept you in,